Understanding breast anatomy is vital for recognizing the different tissues and their roles in milk production. The breast comprises glandular and adipose tissues, which are crucial at various life stages. Breast cancer awareness is paramount, as it stands as the most common cancer globally. This underscores the need for early detection and routine screenings to improve outcomes. Triple assessment emerges as the optimal strategy for evaluating breast lumps. This comprehensive method encompasses history-taking, radiological investigation, and histopathological examination to ensure accurate diagnosis. When a patient reports a breast lump, triple assessment involves clinical examination, radiological investigation, and biopsy. This systematic approach significantly enhances early detection and effective management. Mammography serves as the preferred radiological investigation for breast screening, particularly for women over 40, providing in-depth insights into breast health. Conversely, ultrasound is suggested for younger women with denser breast tissue. High-risk females, including those with a family history of breast cancer or BRCA gene mutations, require MRI for screening. This advanced imaging modality offers superior detection capabilities compared to traditional methods. Hyperestrogenemia, or excess estrogen in the body, is a critical risk factor for breast cancer, often associated with menstrual cycle frequency. Early menarche and late menopause elevate estrogen exposure, subsequently increasing cancer risk. Obesity constitutes another significant risk factor due to heightened adipose tissue, which contains aromatase. Aromatase facilitates the conversion of androgens to estrogen, leading to elevated estrogen levels and increased breast cancer risk. Nulliparity, or the absence of pregnancy, raises breast cancer risk since pregnancy and breastfeeding lower estrogen levels during lactation. In contrast, multiparity provides protective benefits against developing breast cancer. T4 classifications encompass T4B for skin involvement and T4C for both skin and chest wall involvement, which are essential in understanding cancer progression and treatment strategies. Inflammatory breast cancer, categorized as T4D, presents distinct symptoms like skin inflammation, necessitating unique diagnostic approaches for effective management. Distinguishing between pectoralis muscle involvement and chest wall involvement is crucial, as pectoralis involvement does not affect the cancer's staging in breast cancer management. Historically, breast surgery margins were set at 1 centimeter, but current practices favor smaller margins to enhance cosmetic outcomes. This evolution reflects the significance of diligent monitoring post-surgery. Radiotherapy is considered essential after breast conservation surgery due to the increased risk of recurrence. This treatment is vital in eliminating any remaining cancerous cells that could lead to complications. In scenarios where breast conservation is not viable, simple mastectomy presents a practical alternative, especially in advanced stages of breast cancer, to ensure comprehensive removal of malignant tissues. Contraindications for breast conservation surgery encompass pregnancy, multicentric breast cancer, and prior radiotherapy to the chest. These criteria play a pivotal role in determining the suitability of breast conservation surgery. Lymph node involvement is a critical aspect of breast cancer management. Axillary lymph node dissection may be warranted when lymph nodes are palpable, indicating potential metastatic spread. Sentinel lymph node biopsy is vital for assessing non-palpable lymph nodes. This technique uses blue dye and radionucleotide methods to evaluate lymphatic involvement by cancer. Breast reconstruction surgery, BRS, follows mastectomy to restore breast appearance. The deep flap technique is recognized as one of the most effective methods used in breast reconstruction. A wide local excision usually represents the preferred treatment for benign tumors like fibroadenomas, thus avoiding more invasive procedures like mastectomy in most cases. Recurrence may, however, necessitate alternative approaches. Fibroadenomas are the most prevalent benign breast tumors, frequently found in women aged 15 to 25, presenting as painless, mobile lumps. Their benign nature makes them less alarming concerning malignancy. Ultrasound typically serves as the investigation of choice for benign breast tumors, confirming their benignity without necessitating a biopsy unless malignancy is suspected. This method aids in effective tumor monitoring. Periductal mastitis, an infection associated with the ducts of the breast, often emerges due to prolonged milk retention. If left untreated, it may escalate into serious complications. The management of breast engorgement involves expressing milk and employing warm compresses to alleviate discomfort. This approach is crucial in preventing further issues like mastitis. Mastitis, prevalent during lactation, is often caused by Staphylococcus aureus, primarily transmitted from the infant's mouth. Early intervention is vital to avert the formation of abscesses. Thyroglossal cysts can lead to complications like fistula formation if not managed appropriately. Understanding their surgical management is essential for effective treatment. Thyroid gland enlargement, also known as goiter, can occur due to iodine deficiency, which remains a pressing issue in certain regions. Identifying the types of goiter is key for accurate diagnosis. Radioactive iodine therapy offers a treatment option for hyperthyroidism and thyroid cancer, leveraging the uptake properties of iodine by thyroid cells for both effective diagnosis and treatment. Papillary thyroid cancer ranks as the most common form of thyroid cancer, often impacting younger patients. Individuals typically diagnosed between the ages of 20 and 40 are particularly affected. Risk factors for papillary thyroid cancer include a long-standing thyroglossal cyst and previous radiation exposure. These factors significantly heighten the probability of developing this type of cancer. Follicular thyroid cancer is the second most common, particularly prevalent in areas with iodine deficiency. This cancer frequently presents in individuals over 50 years old. Medullary thyroid cancer is characterized by neck swelling, a common symptom shared among different thyroid cancers. This swelling may be accompanied by serotonin secretion, leading to serotonin syndrome. Patients with medullary thyroid cancer are often associated with multiple endocrine neoplasia syndromes, specifically MEN2A and MEN2B, which increase the risk of developing this cancer due to genetic mutations. Thyroidectomy remains the standard treatment for thyroid cancer, and it can involve various surgical approaches, including lobectomy and total thyroidectomy. Familiarity with these options is crucial for effective management. Sudden arterial obstruction can lead to immediate complications such as gangrene. Understanding the distinctions between gradual and sudden obstructions is vital for accurate diagnosis and timely treatment. Gradual arterial obstruction often results from atherosclerosis, resulting in slow blood vessel blockages. Symptoms like intermittent claudication commonly manifest during physical activities. Lifestyle modifications, including quitting smoking and maintaining a healthy weight, play crucial roles in managing vascular health. These changes significantly reduce the risk of developing atherosclerosis and its associated complications. Percutaneous transluminal angioplasty, PTA, emerges as the first-line surgical intervention for arterial blockages, involving the use of balloons and stents to repair blood vessels. Should angioplasty prove ineffective, artery bypass grafting becomes the preferred option. This procedure involves utilizing grafts, typically from internal mammary arteries, to restore proper blood flow. Buerger's disease, marked by vascular inflammation, primarily impacts young males. Diagnosis follows the Orleans criteria, which includes symptoms such as intermittent claudication and a notable history of smoking. Connective tissue diseases, including systemic lupus erythematosus and scleroderma, are often associated with secondary Raynaud's phenomena. This highlights the necessity for comprehensive patient histories. Differentiating between primary and secondary Raynaud's phenomena is essential in clinical practice, as this distinction informs treatment strategies and overall patient management. Management for Raynaud's phenomena typically involves lifestyle changes, such as avoiding exposure to cold water. First-line medications for treatment include calcium channel blockers. The classic signs of embolism encompass pain, pulselessness, and coldness, indicating reduced blood supply and nerve sensitivity. Recognizing these signs is critical for prompt diagnosis. Early management of embolism within 6 to 12 hours includes utilizing a Fogarty catheter for embolus removal or administering thrombolytic drugs. Prompt intervention can avert severe complications, such as gangrene. Deep venous thrombosis, DVT, poses a significant risk for embolism, often resulting from prolonged immobility. Preventative strategies such as early ambulation and compression stockings are vital. Veins contain one-way valves that facilitate blood flow from superficial to deep veins, preventing backflow. Dysfunction of these valves leads to increased venous pressure and associated complications. Varicose veins can manifest through severe symptoms, including dull achy pain and visible dilated veins. Patients frequently report these symptoms during medical evaluations. Diagnosis of varicose veins typically relies on clinical examination, yet duplex scans are essential for assessing valve incompetence. Classification systems like the CAP classification effectively categorize the condition. Polyhydramnios during pregnancy can signal esophageal atresia, as the fetus is unable to swallow amniotic fluid, leading to excess fluid accumulation. This condition serves as a vital diagnostic clue. At birth, signs of esophageal atresia include excessive drooling, as saliva cannot pass into the stomach. This symptom is critical for early diagnosis and timely intervention. Surgical intervention typically involves anastomosis to connect two ends of the esophagus if they are sufficiently close. In more complex cases, a gastrostomy may be necessary to provide interim nutrition. The hallmark feature of Barrett's esophagus includes goblet cells, which secrete mucus and indicate intestinal metaplasia. Recognizing these cells is crucial for accurate diagnosis. Regular endoscopic surveillance is essential for patients with Barrett's esophagus, typically every 2 years, to monitor for dysplasia and potential malignancy, with biopsies often performed during these procedures. Esophageal cancer can present as squamous cell carcinoma or adenocarcinoma, with adenocarcinoma frequently arising in patients with Barrett's esophagus. Key risk factors include obesity and certain lifestyle choices. Zenker's diverticulum is characterized by outpouching of the esophagus due to increased pressure, typically affecting the elderly. The condition is associated with complications, including regurgitation and dysphagia. The classical triad of Zenker's diverticulum symptoms includes regurgitation, dysphagia, and halitosis, arising from food collection and risk of infection in the diverticulum. Recognizing these symptoms is vital for accurate diagnosis. Treatment options for Zenker's diverticulum range from cricopharyngeal myotomy to diverticlectomy, depending on diverticulum size. Smaller diverticula may simply require incision to relieve pressure. Endoscopic removal remains the preferred approach for foreign bodies situated in the trachea, bronchus, or larynx to prevent aspiration into the lungs. The urgency of this procedure is paramount. Foreign bodies lodged above the cricopharyngeal sphincter require immediate endoscopic intervention, while those located below may warrant careful observation and serial X-rays for monitoring. The presence of hazardous items, such as button batteries in the gastrointestinal tract, necessitates urgent endoscopic removal due to their potential for causing chemical burns. Quick action is essential to avert serious tissue damage. Lung abscess constitutes a potential complication of nutcracker esophagus, wherein food accumulates and can lead to aspiration pneumonia. This emphasizes the importance of swift diagnosis and treatment. When esophageal pressure exceeds 300 mm of mercury, it induces a corkscrew appearance on a barium swallow test. This classical sign signifies severe esophageal spasm. Borhave syndrome reflects a spontaneous rupture of the esophagus, often resultant from excessive vomiting. This condition presents with severe symptoms and necessitates immediate medical intervention. The presence of gastric folds can hint at serious conditions like Ménétrier's disease, necessitating thorough evaluation. Differentiating symptoms and associated risk factors guides appropriate treatment strategies. Ménétrier's disease carries a heightened risk of malignancy, rendering early detection and intervention vital. Patients frequently require gastrectomy owing to this pre-malignant condition. Esophageal varices may emerge in individuals with chronic liver disease, particularly cirrhosis, leading to severe complications such as bleeding. Management includes endoscopy and medications like 4-octreotide.